today. I'm with Dr. Nona Djavid. Welcome, Dr. Nona. So excited to have this conversation with you.
Yeah, thank you. I'm excited to be here.
Yeah, we're excited because you are such an incredible thought leader in the chiropractic profession, and the impact that you've had on so many practitioners and their practices and their lives is amazing. And so I'm excited to share this message. And for those not familiar with the impact that Dr. Nona has had, she is an author, a speaker, a coach, and a true visionary. She has established her practice in Newport Beach, California, shortly after graduating from Life Chiropractic College West, and her exceptional understanding of communication, business processes, systems, and marketing principles propelled her practice into the $1 million mark within a few short years. And after successfully growing her practice and impacting so many lives, Dr. Nona founded the part-time $1 million cash practice, a system that helps other like-minded chiropractors tap into their own chiropractic conviction and create systems that are aligned with their unique strengths. Insightful coach with Dr. Nona spends her free time with her family and traveling the country to speak at chiropractic colleges and seminars, as well as appears as a guest on podcasts and radio shows, which is why we are so grateful that you hear us as a guest and share your insight and wisdom here. Currently working on her TEDx talk, focusing on home birth and informed consent. She is an amazing speaker, an incredible thought leader, and now to bring you breakthroughs in practice and in life, Dr. Nona.
A little bit about myself. If we haven't connected in the past, I didn't start out having a successful practice. As a matter of fact, I started out with this dream of building a successful practice, as I think many of us chiropractors do, or chiropractic students. And somehow I ended up in some kind of a rabbit hole in which I burnt out in practice. And hopefully that's not you, but you probably know someone in our profession who has been burnt out in the process of building a practice and a process of serving other people. And that certainly happened to me. Now, as I shifted over, as I paused during my burnout season or process or year, I guess, there were definitely things that I knew I had to do differently. And there were series of events that happened. I don't believe there were coincidences. These series of events that happened, they were mainly from my patients, lessons I learned from my patients. And as I did that, I learned not just success principles, what makes somebody successful in practice, because you can be successful but not have fulfillment. You can have success, but if there's not enough foundation in serving other people, it might burn you out. If you're focused on the wrong things, it might burn you out. So I learned a lot of success principles in the process that helped me come out of the burnout and build something that was absolutely fulfilling for me. In the process, I also realized that there were 3 core areas that I needed to work on, that I needed to, they were the pillars of having anything that is valuable. Whether you're talking in a relationship, whether you're talking a dream life, whether you're talking a dream practice. So obviously today we're talking about having your dream practice, or having making your practice smooth and serving more people. And so one of those pillars happens to be communication. And I think that you probably agree that it is one of the most important things that a chiropractor can learn beyond the adjustment, beyond the technique, beyond the clinical portion of things, because you can be a great clinician, you could be a great chiropractor, you could have great adjusting skills, but if you're unable to communicate chiropractic, if you are unable to communicate the philosophy, and if you're unable to also get from the patient what they are going through, so two-way communication, then that's not going to be as helpful either, because you won't have those people in your practice to be able to serve and save via chiropractic. So as I was coming out of the burnout, I realized that I wanted different results. I wanted a different kind of practice. And so I had to do things wildly different. What was available to me at the time were practice management groups that had been around since the 80s, probably prior to that. And so some of the ways that they were teaching us how to do things, whether it was in communications or sales or patient journey, were not aligned with what is available today or how people communicate in today's world. So I have a course that I actually teach. It's called 10 Rules of Communication. So I thought for today's conversation, I won't be able to go through all 10 of them, but I will kind of cover a few of those, maybe 2, 3, or 4 of those rules, as much as time allows. So as I mentioned, majority of everything I learned in practice, and I learned from the experiences that I have had. And I think that you all relate to that. One of the things that happened to me shortly after graduation, I was a young chiropractor. I had a patient of mine was dragged into the office by her boyfriend, who had been in my practice as a patient for a while. And I share this story as many chances as I get because it's such an impactful story for myself. And I feel it's important for especially new chiropractors, but I think you've experienced something similar. And when I share the story, you'll see why. So Megan walks into my office. Her boyfriend at the time had been a patient of mine for about a year, maybe longer. And every time, his name was Brian, every time Brian would come in, would say, I need to bring my girlfriend in. She's in so much pain. I keep telling her about chiropractic. I keep telling her about you. I keep wanting her to come in and get adjusted. And I think you probably relate to that. That can't be the only time that has happened. It used to happen in my practice a lot. And so finally, Megan walks into the practice. She's in acute pain, severe acute pain. She's got sciatica. And as she's tingling and numbness going down her legs. As I start to talk with her, though, it seems like she's got 30 different health conditions, symptoms and health conditions going on. Everything from heartburn to indigestion to depression. She's on a list of medications. She's taken about 10 plus different kinds of medications just to be able to survive and get through the day. And Megan took a chance and started chiropractic care. And I started working with Megan and a few months, and I did CBP, chiropractic biophysics. So I'm seeing her 3 times a week following the structural sort of corrective protocol. I'm seeing her pretty frequently, and I'm communicating as at the level that I understood at the time, every time that she comes in about chiropractic. And eventually, she started to feel better. She came off of majority of her medications, and she was relieved of majority of the symptoms that she had. And I know that you all have stories like this in your practice, right? And this is a very typical chiropractic story. It got interesting because she brought in, because of the results that she was getting, she brought in her daughter, Audrey. Now, Audrey at the time was only 3 years old, and she had already had multiple surgeries because she was born with congenital heart failure. And she's on a list of medications. She's taken about, again, 10 plus lists of medications. This 3-year-old complaining of headaches, can't go out to play with other kids because she would just get sick. Her mom wouldn't let her go out and play. She didn't have a normal 3-year-old life. Her self-esteem was affected. She was on breathing treatments on a daily basis. And I mean, the list of her conditions continue to go on. We started chiropractic care on Audrey, and Audrey started to feel better. Came off of a lot of her medications. We worked with her cardiologist to get her off of those medications. And she started to just feel better, be able to go outside. She reduced her breathing treatments by 80%. Now, that's not where the story ends or really begins. I was told, all right, which I think everybody is now these days doing, is getting a video testimonial is probably a good idea. So I gathered a few of my patients, about 5 of my patients, and I picked Megan as one of them, not because I thought it was extraordinary results, but I thought she was in my niche market. She's a mom, she's well-spoken, she looks good, she's got a kid, it could be a cute dynamic. And so Megan was one of the 5 patients that I had asked to come in on a Saturday and asked the videographer to come in and video these testimonials. I asked Megan 3 questions, and the last question I asked Megan completely changed my life and my practice. And hopefully it will impact you as well. I asked her what her life would look like if she didn't get chiropractic care, if she didn't walk this path, if she didn't start care in the office. And, I was expecting her to say, my life would be miserable. I would be in pain. I would have so much more of my sciatica would get worse. I'd be disabled. No. What she said next after that question completely shocked me. She said, 2 days before I walk into your practice, I was going to commit suicide. And I had no idea. And it was in that moment that I learned a couple of different things. One, I learned conviction, that every patient that walks into the practice is going to be a matter of life or death, because you never know when it is. You never know when it actually is. And so that gave me conviction around chiropractic. And so I treated every single one of my patients, and my staff as well, trained my staff to see the patients as a condition that might be a life and death situation. And you know what? Just in the past few years, with all these celebrities that have taken their lives, perhaps one touch can save somebody's life. And I also learned about consequences. What would have been the consequences of Megan not taking action and not doing something? And that applies across the board. In your relationship, what are the consequences of you not doing something? In your health, what are the consequences of not doing something? Oftentimes we think about the consequences of, if I sign up for this program, if I buy this equipment, there's cost and there's time involved. These are the consequences we think about. But what we don't think about is the consequences of not taking action, of not investing in ourselves, of not having that chiropractic conversation with somebody when they're rubbing their neck at the grocery store. And another important thing I learned was how communication, the role of effective and impactful communication. Megan taught me that. Because the thing that I realized was that, I understood from chiropractic teachers and chiropractic thought leaders is that you just get excited about chiropractic and you tell the chiropractic story, and then everybody's going to line up and everybody's going to want to get excited about chiropractic and sign up for care and be under chiropractic for the rest of their lives. But you know what? I realized from this experience that the reason that patients get under chiropractic care is actually not inside of any of us chiropractors. You could be the most excited, most passionate chiropractor in the room, but that might not be the reason they sign up for care and they start chiropractic care and they bring their family members. As a matter of fact, the reason that patients sign up for care and they get under chiropractic care, they buy into the chiropractic philosophy, they buy into the chiropractic lifestyle, that reason is actually inside of them. So it becomes our job to uncover those reasons. And not to get technical here, but this was one of the things that I teach is, how do you find, during a consultation, for example, what's one way that you can find what's inside of the patient? Of course, we do the OPQRST and we ask their history and we figure out what's going on, but that's not what I mean. The reason Megan signed up is because she had hope and she didn't want to kill herself, because at the time, her thought process was, 2 days before she walks in, her thought process was, somebody else is going to take better care of my baby girl. However, the reason she signed up had nothing to do with sciatica. It had nothing to do with the conditions. It had nothing to do with coming off of her medications. It didn't even have to do with her health. So I think as chiropractors, oftentimes we are used to asking or we are trained in asking situational questions. And for the sake of time, I'll just give you maybe one example. And hopefully this won't offend anybody or it won't upset anybody. If you are doing this, just kind of evaluate. If it's aligned and it resonates, then, shift the way that you're asking questions. But how often do we ask our patients what makes it better and what makes it worse? That's considered the first type of question, which is a situational question. It just kind of brings about the current environment. Currently, what is happening with this pain? What makes it better? What makes it worse? And I think one of the worst questions we can ask is what makes this pain better? Because you automatically got your patients to start to think about the yoga, the essential oils, the stretches that they do, if they put a pillow under their knees, and if they, sleep a certain way, and if they take a certain pill, then their pain goes away. So all of those become a situational question. Now, we are better off pivoting those questions and asking problem questions. Problem questions are the kinds of questions that actually uncover, they go a little bit deeper. And sometimes they're referred to or they're explained as you're asking functional questions. So in your life, how is this influencing you? What is this not allowing you to do in your life? And a couple of other things, again, there's not enough time to go over everything, but affirming what you have heard and reflective listening. This is all from, if you want to look it up, the only peer-reviewed sort of research is around doing consultations. This is in psychology, not necessarily inside of chiropractic, and it's called motivational interviewing. So affirmations, reflective listening, mirroring statements, and of course recapping their entire consultation and the entire symptoms that they're having. If you go over the list of symptoms that they're having, repeating it back to them and mirroring it back to them, allowing them to see the pain that they are experiencing and how it is actually influencing their life. This is one of the ways, and I know it's on the surface, but you can get to what's inside of your patient. This one is really important. Law of detachment, law of neutrality, and being in a state of flow. I've got tons of stories like this, but what I learned maybe I'll share the story. I'll summarize it really quick. I used to do a dinner with the doctor events. Before I invited this one particular patient into dinner with the doctor, she walked into the office. She clearly could not afford the services. I mean, our packages were pretty large, and doing CBP, they're coming in often. She could not afford the services that we had. She was a student at UCI here near us, and but I kept having to go back to the law of detachment, because if I had thought about the outcome, like this person is not going to be able to afford the services, if I kept keeping that in the back of my mind and was motivated by the financial aspect of things, I would end up compromising the way that I communicate. I would end up compromising all of my systems. And at the end of it, it wouldn't serve either of us. But I kept having, and it was hard work, I tell you, and this is me putting myself out there. It sounds like I was judgmental, and maybe I was, and it was wrong. But I was trying it moment after moment, breath after breath, to sort of create that state of detachment and that state of neutrality. I did not compromise on any of my systems, the way I would educate about chiropractic, all of it. She starts care. She ends up getting a student loan that would cover the care that she would get into the office. And that just blew my mind, that somebody would see that much value in chiropractic. Not only that, she came to a dinner with the doctor, brought a bunch of her family members. The next day, I'll never forget this. I was adjusting it. By the way, the reason she wanted chiropractic care is because she'd been wanting to become a dentist since she was 3 years old, and she developed lower back pain. And so this lower back pain would prevent her from her dream of going to dental school? How could I be a dentist if my lower back is hurting constantly? All right, I'll sign up for chiropractic care. I'll take a loan from the school and I will pay it off. She came to dinner with the doctor, and the next day, I'll never forget this, I went to go adjust her neck. She's laying face up. She said, you know, my life completely changed last night. She said, after knowing everything that I know about chiropractic, there is no way that I can become a dentist. She chose to become a chiropractor. And I think she's graduated now from Life West and practicing, or about to, perhaps she's an associate looking to open up her own practice. So this was an example of this law of attachment. It was no easy task. And I've faced patients in which, you know, you kind of make an assumption. It could be a patient where their father was a chiropractor, or they are a massage therapist, they are a nurse, and you make assumptions about all the things that they know, so you're not detached from the process or from the end result of the process. And so when you can get yourself into a detached process, you are going to be in a state of flow in which the thoughts and feelings that generally cloud your mind, such as stress, worry, self-doubt, take a back seat. When you achieve this state of flow, and you'll end up doing things without having to think about it. And then I came across this map of consciousness. All right, this is a beautiful thing. I know that all chiropractors have read this book and have studied his work. But if you take a look at where desire is, right? Like, I want this patient to get chiropractic care. I want this patient to sign up. I want this patient to understand chiropractic care. I want to help this patient. What is all of that? All of that is desire. But do you see where desire is? And it's at 125 in terms of its frequency. But guess where it is? Look at where it's sandwiched in between fear and anger. So think about that. Anytime you desire something in practice, you want your patient to sign up for care, or anytime you desire anything in life, a dream practice, you want to help your community, any of that, desire sits between fear and anger. Once I discovered this, then that flow thing we just talked about, the law of detachment, actually started to make sense. So I am so much better off if I can get in a state of neutrality, if I can get in a state of love or joy or peace before I touch my patients, or before I go in with a new patient, or before I do a report of finding. So this was pretty profound for me. Again, the couple of the things, and I don't want to go over the time, but a couple of the things I shared, they're from the 10 rules of communication. You can take notes here, or connect with me. I'm happy to share these with you. And last one I will share for today is the importance of focusing on the timing and the trend when you are doing your OPQRST. I listened to so many recordings of day ones and day twos of doctors that I work with, and the OPQRST takes the human portion of things out of it, takes the connection out of it. And so when I have my doctors focus on the timing and the trend, which is part of the OPQRST, it has a different feeling to it. What is timing? It's basically, how long has it onset? How long has it been going on? What about prior to that? And then trend, how about the frequency of it? The frequency of it changed in the amount of time that it has been going on. If the focus stays on the story that the patient has about their pain and about their conditions, then you are going to get what's inside of them, instead of being the excited chiropractor and having a mismatch with the person that is sitting in front of you, and not having to make that, and having that ability to make that impact. And I just want to mention the consequences part of it again, because it is how I live my life. Instead of looking at the things What would be the consequences of you not showing up to this call today to get the information that you got? Instead of, oh, the consequences, I got to sit down, I got to assign time, I got to make sure that I'm here, I'm taking notes. What would be the consequences of not doing it? How many lives are influenced if you are not doing that? How many lives are affected if you don't buy the equipment or if you don't invest in yourself? And that's sort of the summary, a short version of what I wanted to share with you guys today. I hope that it was valuable. I hope that you got one little nugget that will change your practice or influence or impact your practice. And feel free to connect with me anywhere.
Dr. Nona, I always love speaking with you, and I appreciate you've always got such a message that's so important to hear and not always easy to hear, because we need to make changes. And that's the first question I really have for you. I want to talk on 2 points you raised there. And the first is, many of us as chiropractors, we love what we do. We're passionate and we know we're making a profound impact. And yet there are always levels of impact that we can make, just like there are levels of ascension that Dr. Hawkins talks about, where we get to that enlightened point. And when I think about what you spoke about there, of conviction, be able to speak your truth, or to speak chiropractic truth, to be able to influence in and through chiropractic and have the impact, that conviction is imperative. Yet many chiropractors withhold speaking the truth because perhaps they don't feel the conviction they need to be able to do that. So what is your thoughts or advice on a chiropractor being truly convicted in the chiropractic message they have, for the impact that it's going to have for that patient, their lives, and their whole trajectory of their life, in fact?
That is such a great question. And I asked myself that question right before Megan came in. For about 6 months prior to that, I kept asking myself the question of, well, how do I get more of this conviction that I hear about at these seminars, right? I go to seminars as the chiropractic students. You got to be convicted about chiropractic. All right, well, where do I buy some? How do I get some? And so one of the things that I personally had to do, even prior to Megan coming in, but even after, as a reminder to myself, I play this game with my staff, because it's not just about you gaining the conviction, but also passing that on to your team members. So I had to learn ways in which I could pass that on, because Megan didn't happen to them. It happened to me or for me. So I play this game called the possibilities game. All right. So a patient comes into the office and they have their mom of 2 kids, and she has a headache. She gets a headache 3 times a week, and she's got 2 little kids. And during our team meeting, we would play the possibilities game. What is possible for this mom if she doesn't get under chiropractic care, which is the last question I asked Megan. And so my staff would kind of run through the possibilities. They would say, well, if she doesn't take care of the headaches, not just don't stop it, they will get worse, her health will get worse. Sure, but what is the possibility in her life, in the next generation? And so my staff would say, well, she probably is not going to be as good of a mom to her kids. She might have less tolerance. She probably does. It's going to affect her intimacy with her husband, with the dad of the children. And if it is doing that, then it's probably possible that these kids are not going to grow up in an environment filled with love. And if that is going to happen, then those kids are going to grow up and have self-confidence and relationship issues, right? So we would play this game and we would go layer after layer and we would get super deep around it. And then we would do this at every team meeting and sometimes at every pre-huddle, because that is the perfect principle of chiropractic, the ripple effect of chiropractic. But sometimes you got to play that game out because you don't know. You don't know what's inside of the patient. But by playing the possibilities game, you are creating that conviction around what chiropractic does for people.
Yeah, that's beautiful. And not only from the story you shared with me, and we've all experienced it in practice, and we all have that story of the lives that we've changed. Chiropractic does change lives. So the importance of conviction cannot be understated. And it's not just one of those, cliched statements. Yeah, we change lives, but no, we save lives. And the value and importance of what we do cannot be understated. And it's not going to be every life is changed or saved by virtue of them coming to the practice, but really it's one life that we could save that makes the difference to that family. And so it's continually worthwhile to revisit that exercise. And I love that, and I'm certainly going to introduce that here in my practice as well. The last question I have before we finish up today, which extends into that last point you said there, which is communication. You highlighted the different questions we can apply, the different approaches we can take, and you can certainly, everybody, the details for Dr. Nona, you go back. She had that on the page, and you can screenshot that, reach out and learn the communication skills that she's speaking about, because we can all develop and improve our communication skills, and Dr. Nona is an amazing teacher of those elements. The question I have, though, is not to teach those communication skills here, is to ask your thoughts on how the practitioner develops the courage to change their line of questioning, to evoke different responses when it's so much easier to use what we learned at university or college, to speak on the fundamental level of our, what makes this better, and to use typical transactional conversation instead of interviewing for purpose and meaning. How do we actually overcome our resistance to do what's difficult, to learn something new, and face that with courage so we can be more impactful?
I think firstly, if there is resistance, you go towards it, right? That anything that you're resisting to do, there's probably something to be learned about. And I would go back to the sort of concept of, what are the consequences if you didn't? What are the consequences if you stuck with the old ways of doing things? Now, having said that, I know I didn't go in depth in today's concept, so someone might look at that and say, well, I don't know if that would actually work or how it would work. Then I think to bridge that and play with it, you can still have the foundational questions that you're asking, but pivoting and adding something new, and then checking with the response that you're going to get from the patient. So that's sort of a practical answer, but more of a philosophical answer would be, well, what if you didn't? What if you continue to do the same exact thing every single patient? You'd get the same exact results you've been getting. Now, if that works for you, then great. If not, then up-leveling your communication, getting uncomfortable, asking different questions, and experimenting with those questions as well, not just from learning from me or somebody, but testing it out and seeing how your audience responds to different questions.
I'm confident the way they're going to respond is to be more responsive to you as a practitioner, more responsive to your care, to your recommendations, to making changes in their health and their lives, and placing their health and need for chiropractic foremost in their mind. And that is a byproduct not only of communication, but also your conviction, because they now understand the consequences as you have. And that is why Dr. Nona is such an amazing coach, incredible thought leader, a brilliant teacher. You have her details. Reach out. Dr. Nona, always love connecting with you. I'm so grateful and appreciative for the connections that we've made and the conversations that we've had. And I know people reaching out will feel exactly the same.
Awesome. Thank you so much for having me. I appreciate you.